have this new puppy, you have this new kitten, maybe you have a new dog. You bring them home, and now what? What food do you feed? What vaccines do you give? How do you raise this new pet holistically? I'm Dr. Katie Woodley, the natural pet doctor. Today, for Coffee Talk with the Doc, we are going deep into what does holistic mean and how do you raise these beloved, precious pets right from the start. So as you're popping on live with us, say, hey, I'd love to hear from you. Hi, Sue. It's so great to see you. And also, put those questions in the comments so I can see what they are so we can make sure that I cover those. This is a big topic. So this is going to be a short, brief summary of everything that we want to do to help our pets so that they thrive right from day one. So if you've been following me for a while, you know about Finn. So Finn was our precious German Shepherd who, love of my life, soul pup. If you've ever had a soul pup, send a heart. You know what I'm talking about. And he passed recently. He passed at the end of March, unfortunately, from a brain tumor that caused seizures that we couldn't necessarily control. And with Finn, I was in vet school when we got him. We got him as an 8-week-old German Shepherd puppy, precious, the cutest little thing. And I'm learning all about the right way to raise a puppy. So he's on kibble. He's on, I don't know, probably science diet. He's getting all his vaccines. He's getting his monthly flea and tick prevention. He's getting his monthly heartworm prevention. We were very lucky in that he actually wasn't sick a lot throughout his life. And it goes to show that things can be happening because he still developed a brain tumor, but he didn't have a lot of drugs. He didn't have a lot of medications, anesthesias. I think he had like maybe 2 or 3 dental cleanings at most his entire life. So not a lot of drugs went into his body. We lived on a lifestyle block in New Zealand. He had land. We went to the river. We went to the beach. Perfect life, right? Then we came to the States and we brought him with us. And that's kind of when things started falling apart. And honestly, I'm not against leptospirosis vaccine, but we gave him a leptospirosis vaccine before moving up to Fort Collins. He started having urinary issues, and then he started having seizures years later. And I always look at him and I wonder, what could I have done differently? Created courses from that. I've created ebooks because I don't want pet parents to be in that position that I was in, where I thought I was doing everything right. Yes, I was learning it in vet school. Like I learned it, what to do right. And it's conventional. And yes, there is a time and a place. Here's my disclaimer. I am not against conventional medicine. There is a time and a place that we need to give that to our pets. I am not against vaccines. I am for vaccinating appropriately and making sure that we're doing titers and we're giving the vaccines that are truly needed and we're not overloading a pet. Time and time again, I see pets receiving vaccines when they're sick. And that makes me crazy. So what we need to be doing, I have a kitten in my house that's destroying things behind me. So if you hear anything or anything falls, that's the kitten, just FYI. So back to where do we start? Okay, you have this new pet. First, food. So we definitely need to look at food. And what food are we feeding? And now this is a hard one because I talk a lot about whole, real food nutrition. And we can create a lot of problems with our growing pets, kittens, dogs especially, when we unbalance that diet. And so a lot of times what I do, especially with clients that are worried about, not necessarily following things to a T with making sure the vitamins and minerals are all right, everything's in the right proportions. We've got that calcium phosphorus ratio, definitely making sure that that's appropriate so we don't cause bone deformities. I've seen it. I have clients that have pets that have had that unfortunately happen to them. And it's a lifelong thing. Like it's really hard to overcome that and they may need surgery. And so with these puppies and kittens, a lot of time I recommend a good pre-made balanced food. So this could be a raw, if your pet can tolerate that. And we know it has those vitamins and minerals in it that meet the growing needs and requirements of your pet. Could be a really good kibble. Origin is a great brand. And they have a lot of different variations for adults, for seniors, for puppies. So getting them on those good brands and not just going, yes, so we feed Royal Canin and Science Diet because that's what's at the vet clinic. Like I recently had a client with a golden retriever puppy, 10 months old, so a little bit older, but still growing and still needs to be on puppy food and already having allergy issues. And the biggest thing is that they were recommended foods that had all sorts of corn, GMOs. There wasn't even protein in it. It was just byproduct meal. And I was like, what is going on? Why are we recommending that? And it was one of those big brands. And I was just like, wow, there's just a lot of things that happen that we need to look at in order to really help our pets. So if you guys are on Facebook, I am having some internet issues, so you might notice it comes in and out. So I apologize in advance, but this will be posted. I'm recording it. So just I want to give you a little bit what's going on here. That's why we're a few minutes late. And so with that food, ensuring your cat, ensuring your puppy are on the right diets. Cats, so we want to look at, okay, cats are obligate carnivores. If you have a kitten, do not feed them dry food. Don't start the carb addiction right from the beginning, because when you try to transition them off of the dry food, high carbs, low quality proteins, usually, it's not the most biologically appropriate diet for those cats. It can be really difficult. They get addicted and then we can't get them off of it. And we're like, God, I wish I hadn't done that. So start with the canned food. You can always transition to raw. Alongside that, whenever we're using a kibble diet, we want to use a digestive enzyme, because we're using a food that's, it's not the best, but we know it's balanced. We know it has those vitamins, those minerals, and the right ratios where we're not going to cause a growth deformity. That is the most important thing. Like, let's not cause issues that they're going to have to deal with for the rest of their life. So how do we help them absorb that, break down the foods, break down the carbs, break down the fats, break down the proteins, digestive enzymes? And there's a lot of different digestive enzymes out there. RX Vitamins, love that company. They have an RxZyme that you can buy online. Sprinkle it on the food, and that's going to help with every single meal that you're giving. Also, probiotics. We need to support that GI health. We need to make sure this pet is not developing leaky gut. So using probiotics right from the start. I talk a lot about probiotics, so make sure you check out some of the other blog posts we've done, some of the other videos on our YouTube channel, and also at thenaturalpetdoctor.com, because there are certain requirements I look for to qualify that probiotic as a quality probiotic. We want to make sure there's over 10 billion CFUs, colony forming units. We want to make sure we're getting a good range of bacteria, so broad spectrum. So that's definitely something we want to be looking at. And Kendra, great question. Feline natural, all ages cat food. Feline natural, I'm actually feeding my cats that. Kiwi doesn't like it, my senior cat, of course. She's more picky, but the kitten, who should have named him Piglet, super excited about food. And that's a great food if it's the one I'm thinking of. So there's a lot of different foods. And so with Feline Naturals, it's got organ meats, it's got real meats, it's from New Zealand. Like, I trust New Zealand. Even if I didn't go to vet school there, the animals are raised on grass. They're not pumped full of like growth hormones. There's not all sorts of antibiotics that are put into these like animals. And so Feline Naturals, great one. They have all sorts of different canned foods. Definitely use those if you can. And then Nom Nom is another brand that you can use that is a great whole food brand. So definitely check out those. There are a lot. Open Farm is another one that I've come across recently. And as people bring suggestions, if I've never heard of it, I go and research it. I'm like, this is a good food. So keeping in mind too, one of the things I do look for is what are the backgrounds of the people making the food? Is it someone off the street that just decided they didn't like pet food and has no background in animal science and animal nutrition? Or is it a veterinary nutritionist? Who is formulating that diet? Anyone can buy the book, the NRC book, the National Research Council book that has all the like numbers and make a food. But what about the digestibility? How is it absorbed? Like those things need to be done with these diets, or else we're going to cause a lot of issues. Anyone can make a food. And so what we want to do is take a look at what's that company, is that company ideal, and make sure that that pet is. I noticed that Finn had some health issues within days of receiving that vaccine. So let's talk about vaccines. Vaccines are a hot, heavy topic, and a lot of people get really upset with vaccines. There's a lot of controversy surrounded with them. There's also a lot of good things that vaccines have done. And the biggest thing with that is with those vaccines, we've reduced parvo, we've reduced distemper, we control rabies. And with the vaccines, we typically start at 8 weeks. There are so many breeders that give them earlier, and I wish they would stop doing that. The thing with giving those vaccines earlier when they're getting the mother's milk, so they're still nursing at that time, cats and dogs, is that mother, if she's been appropriately vaccinated and has immunity, so we'll talk about titers and what that means, she's passing that. That's maternal antibodies to the puppies. And so we don't need to vaccinate those puppies so young. And if your puppy's been vaccinated, like there's nothing we can do. If you get a dog and they've been vaccinated really early, we can't like take it out of them. We can't reverse that. That's where utilizing gut health, supporting immune system, using the right probiotics, digestive enzymes. We can use things to help detox them gently if we need to, if we're seeing other symptoms of disease. But vaccines aren't bad. They're bad when we overdo them. So we should be vaccinating. And there's different ideas out there so typically a normal vaccine protocol, 8, 12, 16 weeks. 16 weeks is the youngest that they will be getting the rabies vaccine. I saw someone ask a question about that. And so when I used to do these, I don't do the vaccines anymore because I just focus on the holistic side with my practice. When we would do the vaccines, we'd give like 4 vaccines all at once. What you want to do is you want to spread those out. We have this little animal that gets the same amount of vaccine as another animal. And we can't reduce legally, especially with the rabies, we can't cut it in half. And there's a lot of revolution around how do we change this legally. And so there's a lot of things that are happening in the vet space. It just takes a lot of time, and it needs the research to show that half a dose of rabies will protect that pet because it's smaller, just like it would for a 75-pound dog. So 8, 12, 16 weeks, that's the norm. However, splitting up your distemper and your parvo, most clinics have that combined. So that would be one vaccine, and they're actually being protected for 2 different diseases. And then Bordetella, so that's your kennel cough vaccine. This does not mean that your pet will not get the disease. It's like a flu vaccine. We're hopefully reducing the symptoms, helping you to fight it off and protect you a little bit more, but it's not a guarantee. And I see a lot of people get really upset when their dog develops kennel cough. Now, if your dog is not going into contact with other dogs, so they stay at home, you take them for walks, they're not going to the dog park, they're not going to the groomer, then what we need to do is assess, does this pet truly need this vaccine? It's the same with cats. So cats typically will get their feline distemper, upper respiratory calicivirus vaccines, panleukopenia. That's the core vaccine. The cats need that. And then there's also the vaccine feline leukemia. Is your cat going outside? It needs it. That disease is spread through saliva. So we need to be looking more at the risk, the benefit risk ratio. Is your pet coming into contact with this disease? Leptospirosis, we don't start it at 8 weeks. We typically start it later in the protocol because it can have more side effects. So you want to separate it from the other vaccines too. But if you're in an area where there is wildlife, so I think, Sue, you asked a question. You do have deer, bunnies, squirrels. Everyone has mice that come. We saw some mice in our garden, and there's no trash. It's clean, but there's flowers and bird seed, and mice can go anywhere and they can spread lepto. I've had patients that have died from lepto that never left their yard in Colorado Springs, and they received hospitalization, IV fluids, IV antibiotics, everything that is supposed to fix it, and they still passed. So that's where we have to look at the risk ratio. So for Sue, say like Sammy, yes, I do think they still need that vaccine. But what we want to do is make sure that Sammy doesn't have any other health conditions at the time, to make sure that his immune system is ready to handle that. Because if they're sick and we give something, so I gave a leptospirosis vaccine to Finn years ago that like kickstarted everything, I feel like. Before, I was doing a lot of holistic medicine, and he was stressed. Like, we were moving, there was big transitions happening, changing jobs, lots of stress. We were stressed, moving house, renting, going from selling our house. And I gave him a vaccine. I'm like, what the heck was I thinking? Like, looking back. So look at your pets. Are they healthy enough? Don't just, every time you go in for like a sick exam and your doctor's like, oh, they're due for their rabies, might as well do it now. No, stop that. If you're a vet listening, stop doing that. Like, we are creating illness. We are creating imbalances in our pets, and we need to stop giving vaccines when the pet is sick. They're there for allergies. Do not give a vaccine, because now their immune system is focused on boosting their immune system and not fighting the allergies and fixing the underlying problem. So there is a time and a place for vaccines. We need to use them appropriately. And we need to better educate ourselves as veterinarians too. Like, what exactly is the purpose of this vaccine? It is not a benign substance we are putting into a pet's body. We need to look at what it does to the immune system, and that pet can come back for a recheck. Like, that's the purpose of rechecks. Let's see how they're doing. Is that skin disease resolved? Now we can give a booster vaccine, or the actual vaccine that they were due for, or I prefer to wait a little bit longer to ensure that they're doing okay. And yes, Erin, that is a great point. So I've read that the main issue with updated lepto vaccines is carrier substances. So it depends. It depends on the different people companies that are making the vaccine. And there are companies that are coming out with like lower doses, the ultra vaccines that have less stuff in them, because those adjuvants are what stimulate the immune system. So things like mercury and aluminum and all sorts of other junk that goes in to irritate. And we can see with cats, especially, they're really sensitive to those kinds of things. And they can actually form aggressive tumors in their skin. So we have to be really careful about that. So ask your vet. They should know like what they're using. So have a conversation. It doesn't need to be heated. You just have a conversation like, hey, is this the best one? The more pet parents ask for those vaccines, they are more expensive. They are. And that's why vets don't carry them, because not enough people know about them or want to pay for them. But when you look at over time, we are reducing disease by not putting more junk into our pet. You pay less over time. Preventative care is cheaper than treating disease, hands down. Like, if Finn was healthy his whole life, like if we didn't deal with urinary stuff and cancer, he would have been one of the cheapest dogs I ever had. So I look at that and I'm like, where could I have changed? I could have done more titers. Could have done titers for him. So let's talk about vaccine titers. What's a vaccine titer? So vaccine titer is where we draw blood and we can look and see, does this pet have antibodies for this disease because their immune system mounted an appropriate response when we gave that vaccine. So when that pet comes into contact with, say, parvo, it's out there, or distemper, like we have raccoons, there's probably distemper around. And say I have a dog and he comes into contact with it on a walk. Those antibodies are what's going to protect him. They're going to fight off that disease. They're going to fight off that virus, and he's fine. So that's the goal. Now, not enough veterinarians are doing titers, and this is something that you can ask for as a pet parent. This is so important, so I hope you're listening to this part. The vaccine titers, we can titer for distemper, we can titer for parvo, we can titer for rabies. The downside with rabies is that it is required by law. It protects us. We have to give it legally. You can still titer for it so you can see if your pet is protected. And then in some states, you can actually waive it. But I know when I'm writing a waiver, when I used to do those, if that pet is protected, I feel a lot better knowing that that's not a like public health risk. Now, once again, there's controversy there with, do these titers, when they're positive, do these antibodies truly protect the pet? It's the best we got right now. So it's the best thing that we can do. So if your vet is vaccinating every year for distemper and parvo, you need to send an update to them and let them know that should be every 3 years. And then I would also be asking for titers. They can send the blood work off to a lab. So if they say they can't do it, you can do it. I know in the States, I'm not sure, I'm sure you can do it overseas. Just ask the vet. Now, Sue, this is a great question. And this is one of the hard things with vaccines. So does Lepto have a titer? And it doesn't. So leptospirosis is a bacteria. And that vaccine only lasts a year. There's actually some question where they're doing vaccines like every 6 months or every 9 months for really high risk areas because that vaccine doesn't last long enough. So that vaccine does need to be given yearly. That's the downside with that one. Same with like Bordetella. With Bordetella, using the intranasal or the oral is a nice way to give that. So we're getting more local immunity. So if your pet's going to the groomer, we need to give that vaccine because it's going to protect them. They're at high risk because there's a lot of dogs. If your dog goes to the dog park, I would do that vaccine. There are not a lot of reactions to that vaccine, but remember, separate it from the other ones. I always separate them by at least 2 weeks. You want to give the body a break. You want to make sure you're not seeing any symptoms or underlying disease flare up because we've kind of ramped up that immune system by giving that vaccine. So that's definitely something that you want to keep in mind and ask for. The more we ask for it, things will change faster. Ask for the safer vaccines, pay a little bit more, but over time, your pet's going to have better health because of that. And then okay, great question. So Sherry asked a question. I've heard that probiotics can cause an overblown bacteria in the intestines, which can cause problems like diarrhea and other issues. Should a person give breaks in between doses? So with certain supplements, you can give them long-term, you can give them breaks. I'm fine with either for the probiotics if you're using balanced probiotics. Now, if you're noticing that your pet is getting some diarrhea or having GI issues, and they've been on a probiotic, they've been doing fine, and then all of a sudden something changes, of course, like we need to make sure that we're ruling out other underlying conditions like giardia or food sensitivities or things like that. But you can always stop them. Stop it for like a month and then put them back on it. So you can definitely do that. Now, in terms of, vaccines, titers, ask for that, ask for those ultra low dose vaccines. Sue, great question. Is it better to get Bordetella nasal or injection? I would ask for the oral. Your vet should be carrying that. The nasal's awful. It's like the pet is suffocating when you give it and they're snorting and then they like become head shy. You're like, now the dog hates the vet clinic. So I would ask for oral, and the oral works just as well. So like I said, these pets can still get kennel cough, but it's going to help protect them and hopefully lessen the severity of that disease. Okay, now we're going to go into another interesting subject that is controversial. Heartworm prevention, flea and tick prevention. Okay, this is the same with what I just mentioned about vaccines. Where do you live and what's the risk to your pet? Are you in an area where there is heartworm? Are you in an area where there are mosquitoes? Are you in an area where there are a lot of fleas and ticks? So Colorado is an interesting area. I'm going to use Colorado as an example. So with Colorado, we have, especially in Fort Collins, we have a lot of water up here, lakes, rivers. There are a lot more mosquitoes up here than I've ever experienced in Colorado Springs. And people assume, because we're not in like Florida, back east, that there's no heartworm here. There is heartworm. And heartworm prevention, there's all different types. And of course, the companies are always coming out with more and more and more different ones, easier to give ones that last longer, so it's more convenient for the pet parent. Heartworm prevention, I still do it. It's still monthly. I still recommend it. And the reason why is because it's so easy for a mosquito to land on your pet and give them heartworm. And now the treatment is really, really toxic. And there are alternatives that people talk about, like black walnut. There's herbs that we can use. I personally do not feel comfortable enough having a pet go on that. And if they contract heartworm, and now they have to have melarsamine injections, it's not healthy. It's like arsenic, not healthy, but you have to do it to kill the heartworm. So when you're using heartworm prevention, use the older versions, HeartGuard Plus, Interceptor Plus. If you have a dog that has MDR1 mutations, you're worried. So dogs that are like Australian Shepherds, some of your herding breeds can have this mutation and it can make them sick. Interceptor Plus is safe for them. It's a lower dose. And what I do and what I tell patients is, or tell clients to give to their pets, detox them for that week. So use something that has like burdock dandelion root, that's going to milk thistle, that's going to help their liver process those drugs. And do it for a week. So you give it once a month, right? It's a chew, and then you detox them. And I have not seen a lot of issues come from those two types of heartworm preventatives. Now, there are ones that are injectable and they last for like 6 months. And there's a new one that came out, ProHeart, 6-month injection. So you get an injection, like it's good for 6 months. And then there's a year one. I'm like, oh, good. The chemicals in your pet's body for a year. Like, what if they have a reaction? And this drug has actually come often on the market due to recalls, health problems it's caused. Like, if I see that, I'm like, don't even go anywhere near it. Yes, super easy. So if you're a person that forgets, download, like, I think HeartGuard has an app and it tells you when to give it. Just download reminders to help you like remember when to give it. So that's my little piece on heartworm prevention. I do still believe that you should give that. I know that's not going to resonate with a lot of people, especially holistic. However, like I mentioned, conventional medicine still has a place, and I'd rather my pet not develop heartworm. Now, if you're in a place that we have winters, like it snows, are there mosquitoes outside? They will say that they can overwinter in your house. So yes, there may be a risk there. However, in Colorado, typically what I tell people is that through March, April, whatever like our seasons decide, Colorado is an interesting place to live in. As if you're here, you know that like it can be summer in March, it can be summer in April. We can get really hot days. When we start seeing those hot days happen, I recommend starting the heartworm prevention. And then when we start getting snow and those frosts and those really cold days and nights, then you can usually stop. So typically like March to October, and then you're giving your pet a break. Now, flea and tick preventative. This is going to depend on your area once again. In Colorado, like I never gave Finn flea and tick preventative. There are ticks all over the place here. We don't have Lyme disease, thank goodness, like back east, which is really bad. But I'd check him. Check between the toes, check under the paws, check in the groin, check in the armpit area, check in the ears, check those little folds, all those little areas where you can see a tick, check them, lift up their tail, look at their butt. Like ticks love that area, and we can easily miss that. So if you're doing that, you need to be checking. There are alternatives we can use, so more holistic remedies there that I feel comfortable using in an area that doesn't have a lot of fleas and ticks. If you're in an area where there's Lyme disease, and I know there's Lyme vaccines for that too, so kind of like Lepto, give it separate if you're needing to give Lyme vaccines. The biggest thing with your flea and tick preventatives, if you're back east, you're in an area where there's a ton of fleas, there's a ton of ticks, and they carry awful diseases like Lyme, use your topicals. The more information that comes out about Brevecto and NexGard and all the health issues, seizures, tremors that don't necessarily go away, it's not worth it. It is not worth it. It lasts for three months. I think NexGard is every month, and it's a chew. And I actually asked the drug rep when we were using this product when I still worked at the clinic, and I said, what happens if they have a side effect to it? Like, what if we get diarrhea? And they're like, you just have to wait it out and treat the symptoms. And I'm like, okay. So yes, it's oily, the topicals. Yes, it doesn't have an expiration date, but it's better than your pet getting Lyme disease. And when you give it, detox them. Just same thing. Animal Essentials, get their detox blend. It's a great product, and you can use that for the week to support them. So Erin, great question. So how do you feel about diatomaceous earth and wormwood? So when I look, so diatomaceous earth, you do have to be careful with, because if your pet inhales it or we inhale it, it's not good for you. The way that it works is that it actually dries up the insect's exoskeleton. So when they come into contact, so it's like shards of glass, like that's what it can feel like in your throat if you inhale this. And so you can actually use that, especially if you have a yard where there's lots of flea nests and there's other things going on in your yard, and lots of shrubs, grasses. You can sprinkle that in your yard too if you're worried like your pet's going out and they're coming back and there's so many fleas on them. You need to treat the yard also, but you can sprinkle this food grade diatomaceous earth. So make sure it's food grade, because your pet grooms themselves. So you need to be aware of that. You can sprinkle it through the fur. Where I tend to use it though, just because of potential health concerns with them ingesting it or inhaling it, is you can use it on the carpet. So you can mix this with like baking soda. You can use it with essential oils that are going to repel fleas and ticks. And you can sprinkle this in the carpet, leave it for an hour or so or longer. Like if you're leaving for the day, take your pet with you, leave it, and then come back and actually vacuum it all up. And so that's a great way to use that. Wondercide is another product. We talked a lot about essential oils. We just did a massive webinar on how to use essential oils safely in your dogs and your cats. It's in our membership, so the Natural Pet Tribe membership. So check that out. The replay's there for forever. And when you join the membership, we actually have an additional bonus live this week that you can be a part of. It's an extra bonus for all our members. So definitely check that out. How to use essential oils for different remedies, pain, GI issues, allergies. We're going to be talking about all of that, anxiety. But with using it for flea and tick prevention, we can use those essential oils. Now, Animal EO by Dr. Melissa Shelton, I love recommending her brand. It is made safely for dogs, for cats. You can go on her site. I think there's there's all different blends for different conditions. So you can also use that safely on your dog. Now, I think, Erin, you're overseas. So that's where we would use things like you can use citronellas, you can diffuse essential oils. There's a lot we can do. We just need to make sure that they're pure therapeutic grade, they're organic, they don't have adulterants or synthetics added to those essential oils. That's very essential that we make sure that those oils are not toxic to our pets, or we're going to cause more health issues. All right, so flea and tick prevention, we can use more natural alternatives. We can always go back to the synthetics if we have a major issue in the house. There are also little Comfortis is a tablet that can work really quickly if you have a major flea infestation. It doesn't last super long in the body. That is a conventional drug. But I see a lot of things in Facebook groups and on where people have massive issues with fleas. And sometimes we do need to use the stronger things in order to get rid of that, because fleas multiply like crazy, especially if you have carpet. So we need to be treating the environment alongside our pets too. One of the things we can do too is we can use garlic safely in the food. So we can use food as medicine. And I don't go over 1 clove of garlic per 20 pounds, but you can crush this up, mix it in the food. You may need to, if you're feeding a kibble, your pet might be like, what is this? So you may need to add some good tasting foods to it. You can always use, love using organic baby foods. We use that in our acupuncture sessions with pets, and they gobble it right up. Get it from this supermarket, just grab the organic one. That's fantastic, Sue. I got Breathe from Animal EO, and it's helping our dog's teeth. It's a great company. Like, it's just fantastic. I have Kitty Boost for the cats, and you can use it for everything. You can put the essential oils in the litter tray. Like, how cool is that? Like, less is more. You don't want to use a ton of it because it's super concentrated, but there's a lot we can do. So food, vaccines, vaccine titers, using natural remedies for flea and tick preventatives. Heartworm, I do recommend sticking with those older forms of HeartGuard Plus, Ivermectin Plus. So if your vet doesn't carry that, they usually have an online pharmacy where you can actually order it from them too, and it'll ship directly to you once a month if you're in an area where you have lots of mosquitoes. But like I said, we have heartworm here. I have patients with it that we're currently treating. So we need to be looking at the risk to benefit ratio for all of these things. Does my pet truly need this? Is my pet healthy enough to have this right now? Super important. Is my pet on the best food? If you need those guidelines, if you need that guidance, we have holistic wellness ebooks for you. I created these because I was like, what would I have done differently with Finn? I've freaking vet school, right? I should have known better, but I was taught this. I was taught the conventional side, and there's a lot of things we would have changed. So those guidelines are in that ebook from start to finish. Kitten, puppies, adults to seniors, and things to watch for. The resources are there for those different probiotics for different conditions. Things to ask for your vet, when to vaccinate, goes deeper into what are those vaccine titers. So check that out at our shop at thenaturalpetdoctor.com. If you're on Instagram watching this, it's in the link in the bio. Super cheap, and you can use it for life, for any pet that comes into your life. That was the purpose of it. I want people to have that resource. There's also a specific cat one, so if you only have cats, just grab the Cat Holistic Wellness Guide. And then if you want more, if you want to go even deeper, that's where our webinars are, our monthly membership webinars. So get in the Natural Pet Tribe. I love my members. I love all of you guys. I want you to be a member and join us every month live where we go deeper. Our webinar this month is on how to choose the best pet food for your dog and cat. A lot of you have questions about foods. We talk a lot about ingredient lists, what's going into your pet's body, and how to assess that. How do you create a balanced diet? If you're thinking of doing a home cooked diet, get on this webinar, because we're going to be talking about how to do that, what resources, brands. I don't talk a lot about brands in a lot of these conversations, but we're going to be talking about brands and a list of the brands I recommend for your dogs and your cats. So check it out. It's in the link in the bio. It's on our website, thenaturalpetdoctor.com. It's going to be a blast. Super excited. And if you want the replay, can't make it live, there is a replay for 72 hours afterwards that you get access to. So don't worry about that. Still register, or if you're like, I'm out of town, join the membership. It's there forever, along with CBD webinars, allergy webinars, nutritional webinars. There are so many different webinars that we have where we cover controversial topics. We talked about DCM and grain-free foods. Huge topic that isn't well talked about with veterinarians to pet parents like you. There's so many amazing things that I want to tell you, and there's not enough time for it. That's why we have our membership, because we can go deep. You can ask your questions. You get me live. So make sure you check that out. We are going to be live again next week, 10 a.m. Mountain Standard Time. We do this every week, talking about different pet health topics. I believe we're covering urinary issues, which can be a major problem for dogs and cats. So join us, and you can always register for these too, so you get reminders when they're going to come up through our Zoom, which is fantastic. And I appreciate all of you. and have a freaking fantastic weekend. It is beautiful. We have some ash from all the fires in Colorado. Remember, your pets can be affected by poor air quality. Saw a post in California, there's lots of fires. Praying for everyone, stay safe. But remember, our pets and their lungs, this can affect them too. So keep them inside. Maybe don't take them for as long as walks, just to make sure that we're protecting them alongside ourselves. So as always, you can always reach me at thenaturalpetdoctor.com, and I look forward to seeing you all next time. Have a great weekend.